communicate those new ideas.
Alrighty, so key steps to implementing our proposal. So we have some short and long-term plans here. So for our short term, we're really looking for interventions to promote those feelings of belonging across staff lines. So intra-departmental staff highlights as managed by the manager. Basically, this would be for clinical, ancillary, and facilities staff. Those are our maintenance workers, clinical engineering, and the likes. Within each unit or department, a staff member would be highlighted probably each month for their good work and the good that they're doing for the team. We're hoping that this promotes individual recognition as well as that professional acknowledgement. And it's been shown in the evidence that support from immediate supervisors has been linked to positive perceived organizational support from staff members. Another plan for short term would be a hospital-wide peer appreciation week. In this week, we were asked all staff to write notes about specific persons or entire departments outside of one's own discipline, giving thanks and appreciation for their contributions. Oftentimes people talk within themselves about how much they respect or, are grateful for other areas, and they don't actually get the chance to tell it to the person themselves. This should be displayed in a common area or like location that gets a lot of foot traffic, not only for staff to see, but also for visitors as well. We're hoping that this promotes workplace trust relationships and promotes intrinsic motivation. Another short-term plan would be a needs pantry located in or near the facility. For many of our healthcare workers, they may be struggling financially, as we've been saying with COVID and everything. A lot of people were impacted and are still going through the consequences of everything that happened during COVID. So having basic needs available to staff members would be really great and show great organizational support. This acknowledges our low-income employees and their needs and shows that as an organization, especially one that's healthcare and about caring, we're not afraid to help out with those people that are in need. We're hoping that this promotes mental health and well-being, thus leading to positive job performance. Some of our long-term goals include, of course, increasing pay. This should be in a negative correlating rate as compared to the highest paid staff. This means that for our staff with the lowest salaries, they would receive the highest percentage raise, and the highest paid staff would see a smaller raise. This would increase retained staff. As we've heard, a lot of people feel they're underpaid, and thus decreasing staff shortages so that everyone knows that there's going to be someone there to do their job, and you can increase that workplace trust for the organization. Another long-term goal is managerial role makeover, which means basically for our department and care unit managers, they will participate more directly in decision-making processes with their superior managers. This would bring relevant issues to the top, to the boards and executives, and also get those solutions back to the unit, as well as new interventions that would need to be implemented, could be talked about and discussed about the efficacy and the likelihood of success, and perhaps fix some of those obstacles before implementing on the unit. This will increase that communication aspect as well as the organizational support. A final long-term plan that we discussed was a loan repayment program offered through the hospital or the hospital network. This would ensure that persons are working for a minimum number of years because of the contract, as well as giving a valuable resource so that it motivates employees to reciprocate that. Some metrics that we would use to determine if we were successful would be retention rates and job abandonment rates, just to see how many people we are retaining over time. Job satisfaction surveys with a structured questionnaire for staff members, just house-wide. We could also do qualitative surveys with unit and department managers to see how their staff are feeling about the changes. As well, we could also look at our patient satisfaction surveys. When we have happier workers, we have happier patients.
Now that we've shared with you guys our proposal, we want to go through by each profession and talk about how the proposal would impact us as healthcare providers. So from a physical therapy standpoint, as Deanna talked a lot about kind of improving just like communication between peers and providers and things like that, increasing the communication would allow for just better patient care overall. So looking more kind of directly at that, therapists spend a lot of time with patients, whether that be 3 or 5 hours a week, depending on the setting. And because therapists and occupational therapists and speech path spend a lot of time with patients, they pick up on a lot more cues and information and just overall emotions that more providers might not have the time to pick up on. And increasing the lines of communication professionally and just teamwork communication would allow for more providers to be aware of the different things that these professions pick up on. In addition, kind of helping create that communication between professions would help get more patients into therapy more quickly, just kind of encouraging different professions to refer out for pelvic floor therapy and other things that are less well known. And also just helping make more informed discharge decisions. For example, if somebody had a flight of stairs and was wheelchair bound, it would be important for PT to kind of pass that along to different professions.
Some of the important things that for RNs would be the importance of delegating to proper disciplines. So in learning to trust and acknowledging those different disciplinaries, we can willingly give care, and not just willingly, but more so knowingly and readily pass on things that could be delegated to others when we have to do other care. Also, there's value in growing trust in a workplace relationship, just knowing that other people are on your side and also can help care for your patients. And that's not just clinical staff or ancillary, but even facilities. We're all working together, and growing in trust helps us to move forward.
Along with that, we also, it's important as an RN to be collaborating with our other healthcare professional, just as Deanna said, along with delegating, also going back and advocating for our patients to the physicians or nurse practitioners or PAs that we're working with, but also communicating with OT or PT the things that we pick up on from our interactions with our patients. And that just goes along with communicating with the team.
Moving more into a provider role, especially when we're coming up with treatment plans, care plans, we want to be able to work with other members of the team, so like PT, OT, nursing, to come up with a bigger holistic perspective of the situation and understand the patient's needs, because they can be unique to the patient and different and changing day to day. And so when we have nursing staff and people on the floor looking at our patients and interacting with them all of the time, it's really important that we're able to communicate with them and provide effective care. So that includes communication with the patients as well, because we want to be able to be in a place where we understand the situation and can explain what's going on with them and help provide effective patient education.
And from the perspective of the medical doctors, the proposal will allow for improved coordination between the different healthcare teams. As part of the role of the medical doctor is to see the patient when they have their presenting symptoms, and not only manage their acute symptoms and their acute condition, but also manage their long-term conditions. And in order to do that, it requires a team effort in order to coordinate between the different medical teams from different specialties and the different physical therapists and RNs and PAs. And to do that, it requires a more streamlined method of coordinating between these teams, and also a proposal of workplace protocols for both acute and long-term conditions and how they're managed. Being able to have these protocols kind of in place is done through coordinating between different teams, and it promotes better patient outcomes.
From the pharmacy standpoint, pharmacists working with primary care teams, you could improve clinical outcomes, as well as increasing the patient level satisfaction. This could occur from collaborating together and being able to provide the best patient care plan so that you could reduce medication related spending and make sure that the patient is on the best plan set out for them. So this could affect the role of a pharmacist or student by improving their knowledge of other disciplines. You're learning about other healthcare occupations and what their difficulties are, so you're able to help them more. You can also apply this teamwork to research and recognizing the importance of other roles outside of our own will be able to help us just in general in our own lives, while also optimizing patient care. So this will achieve the maximum benefit of our interprofessional capabilities because we're going to be able to build trust with our other occupations, as well as our own confidence. If we're coordinating with each other and talking to each other on a regular basis, we can overcome adversity way better than if we were to do it on our own. So teamwork skills would be improved drastically.
Thank you for listening to our presentation. We hope you enjoyed it.